Yep, it's moving, so I guess we'll try it again. Hello, I'm Kay, and I'm in class for Fundamentals of Public Speaking, and I'm in nursing school right now. This is one of my prerequisites for my bachelor's. So for my persuasive speech, I decided to talk about how mental health, sorry, it's difficult doing it a second time, how mental health reform is kind of desperately needed in the United States, and especially in Arkansas. So, I had a friend recently who tried to take her own life, and she has bipolar disorder. A lot of people that she worked with didn't realize that she was experiencing a heavy period of depression for a few weeks, and I noticed that she had acted a little bit more withdrawn. She wasn't completely out of character, but she was a little more withdrawn. And she did seem like she'd been gaining a little bit of weight, but nobody's gonna ask their lady friend about their weight. It's kind of weird. So my friend is now making progress on the road to getting better and reclaiming her life and getting treatment and taking care of herself. But she's not the only person that's dealt with this. So today I'm going to talk about how mental illness has been stigmatized and some of the problems with the system and a few things we can do to help. There isn't one big magical solution, but there are things that we can do to work that direction. Some people are afraid to reach out for help. Some of them are given a label and just thrown whatever the default medication is for that issue, like Abilify for bipolar disorder. That seems to be the popular drug right now. Some people don't even have friends and family to rely on. Some people are completely alone, or they're out in the streets or whatever. So I've seen various people I care about suffering from mental illness during my life at different times. I've had some friends and classmates attempt suicide, and some of them have succeeded. So psychology, neuroscience, and the medical field have always been interesting to me. That's why I'm in nursing school, so I can get into that and be helpful in improving mental health access in whatever ways that at least one person can. I also joined the Depression and Bipolar Support Alliance recently, which they keep you notified with all sorts of tips and info for family and friends and chances to advocate for people. So first I'm going to go over facts and figures about mental illnesses in the United States. Then I'll point out some things that need to be changed, and then last I'll tell you what you can do to help. So, some of the facts and figures. In 2016, the World Health Organization ranked countries based on mental illness rates. The U.S. had the third highest rate in depression, and in anxiety, and in drug and alcohol problems. But they're only behind India and China, and India and China kind of trade place on the tops of those. The National Alliance on Mental Illness states that 1 out of every 5 adults deals with some kind of mental illness at some point in their life, but that only 41% of those afflicted get treatment. So, more than half of them don't get treatment. For a little extra perspective, here are some of the statistics in Arkansas. Out of the 50 states plus Washington, D.C., Arkansas is ranked number 47. So out of being in the country that already has the highest rates of depression, anxiety, substance abuse, we are also the worst at taking care of mental health problems, or one of the worst. A little more than half of the adults in Arkansas that have mental illness don't get treatment. And we do have the highest rate in the country of youth with depressive disorders. It's 77% of them that don't get treatment, not just having a disorder in general. Arkansas has a mental health care professional to patient ratio of one professional for every 520 patients. And that includes social workers and psychologists and all of the necessary people. So that makes it a little challenging when it takes more than one person working on a case to get somebody taken care of correctly. So my second point on it, the statistics, there's one more on here. According to the National Institute of Mental Health, about 38,000 people commit suicide every year. 90% of those people have a pre-existing mental health condition. So based on all of these things, obviously mental health is something that needs a lot more emphasis and care being taken with. what things need to be taken care of to make this better. Based on the statistics, we obviously need more people working in the field, whether it's counselors, psychiatrists, psychologists, nurses, social workers. We need all of those. The number of beds for patients in inpatient facilities has dropped. It's harder for people that need the in-house care to get it because there are less openings available for them. So we need, we also know our mental health care professionals are spread thin. It makes it harder to give personalized care to people. So sometimes people get diagnosed shortcut just based by a few things on a checklist and then given, like I said before with the Abilify, like the designer drug of the moment. So sometimes not all drugs work for everybody, so that's an issue too. The mentally ill and their loved ones also need to become more educated so that they can spot symptoms and take preventative measures and hopefully avoid major catastrophes. So there we go. So that does bring us to the solutions. I was thinking that was all of that. So in 1996, we had the Mental Health Parity Act that was passed that meant that insurance companies had to provide the same amount of money coverage for mental health as they do for medical and surgical, which is good, but at the same time, some mental health care providers jacked their prices up, which meant that they had to pay more out of pocket. And so then the Mental Health Parity and Addiction Equity Act was passed in 2008, which made the co-pays lower. That kind of cut out some of that business. And it put aside some money to better enforce them legitimately taking care of people equally in mental health. Both of those things are good in the right direction, but you also need lots of staff to really properly do that. It's helpful to stay informed of new chances to vote for legislation and things that directly affect mental health and access that people get. So an increase in funding to the field of mental health would be helpful for more beds, and hopefully we can do more preventative measures to keep people from getting to the point that they need to be institutionalized. Most importantly, since we all know somebody that's experienced depression, it's a good idea to learn the signs and symptoms. If you have a friend that has a mental illness, it's a good idea to learn more about it and what you can do to help them if they have a crisis, if something comes up. And sometimes you have to overreach and make their business your business so you can help them, because not all of them are going to come out and ask for help directly. So that's about that on those things. I guess just mental health needs major reform and help, and it's going to have to start with us, because waiting for money and waiting for all these other things higher up that are going to be really important, we're in limbo waiting for things that we can't control, but we can control our own actions with each other and our own interactions with our friends and loved ones. So, thank you, and there we go.
This one too.
You gotta mute the thing.